bony landmark, we need to avoid working on the lower limb.
Bony.
Bony landmark, area that is bone
Or
that
handles.
you don't want to. Let's start with this. Ankles. Yeah, calcaneal bone.
Back of the knees.
Back of the knee, definitely. Side of the knee as well. Yeah. Here.
Hip.
fine.
That is fine. That's
Maybe
fine.
no,
Fine with it,
bonus
that's
line.
fine,
Okay. This is called the greater trochanter of the femur. Yeah. This is the one that you feel in here. Yeah. Good. Around the sacrum and
The hip bone.
yes, it's the iliac
Iliac
crest.
crest.
Iliac crest around here. Yeah. Okay. Good. As usual, I mean, I must tell you, no, the towel and everything that we've done in the course then is the same. The tea towel, nice towel technique, yeah. So I'm not that concerned, and I haven't forgot that. I just want to move on to what really needed to learn. But really, you need to incorporate all what you know about the towel technique, especially now winter. Cover them all through and all that things that comes with it. Okay. So starting with the lower limb. Actually, I will just, usually I would use something a bit more wider. Yeah. Good. Can I tuck this under like that? Good. Fantastic.
Nice.
So, using quite a lot of oil. Maybe a little bit more even.
Dripping as well.
Oh, yeah. Oh, yeah.
Good. And in terms of stone, I would start working with a large effleurage. Yeah, large effleurage stones. It's just fit really to the size of the muscle. 1, 2, 3. That's actually fine. Quick drip, quick dip, drip, and you go. Okay. So area muscles that you can work are the gastrocnemius and soleus in here. Yeah. Now Achilles tendon, you can do, but be careful from going too far down. Good. And then hamstring. Yeah. So it's all quite very deep effleurage. Yeah. Iliotibial band on the side. If you want to help the iliotibial band, you can do something quite simple. Just the leg a little bit to the side, then one hand onto the calcaneal, and then it brings the iliotibial band a bit more out. Or you can do it here. Hold it here, so it brings the lateral side of the thigh closer to you. How's the pressure?
Perfect. I can go deeper if you want.
Yeah?
See, the stone is slightly curved as well.
Yes. Yeah? This stone is slightly curved this way, so it helps in digging in. Really nice. You can do it also on the other side. Okay? Then you can work on the adductor muscles. But be careful when you're coming to the knee joint, yeah? The medial epicondyle here, it's the name of the bits here that stick on the femur, yeah? So, I would like to show you now how to work with two effleurage stones. Basically, you need to take both of them out to prepare it. Then you bring this one in. Yeah. Okay. Yeah. So the same flipping. Remember the flipping? Yeah. So look, a lot of the weight my weight goes on top of it, really. And even you can lift the back leg a little bit to just feel very good for athletes with hamstring, yeah. Then you can do it one side, you can strip it down.
This feels amazing.
Mhm. Yeah, you can do it down in here, but be careful from bouncing onto the tibia or the fibula here. Yeah.
This is really good.
Yeah. Gluteus area, I would prefer usually, let's swap sides. Yeah. Sometimes I prefer to work on the opposite side. Why? Because it's just, your head is there. Yeah, it's a lot easier. So you can, it's actually kind of similar to the shoulder. You can work on the gluteus medius and maximus. Yeah, you can work onto the deeper muscle bite, again tilting it. Do you see that's tilt? Yeah, going into here. Yeah, you can work from the sacrum downward. Be careful because there is another bone here, right? The greater trochanter, yeah, which is kind of more to the side, yeah. Yeah, even working from on this side, you know, going a little bit down would be good. A lot of runners, very, very sore in here. They can have even backache because that area is tight. Because if this area tight on both sides, then the other area that moves is the lower back. It's like they're too restricted in the hip movement, so they do a lot of movement from the lower back. So back aches. If you let them to do a bit more, you know, freedom there, they will be having a good effect. So to some client, I tell them go and have salsa class as an aftercare. Yeah, because once you move the hip, the back does not use too much, you know. And you see a lot of people, sometimes even the jeans that they are wearing. How can you move your hip? You can't move your hip. And what happens is that you move a lot of the lower back, and you see a lot of these, rather than kind of moving more with the hip. Yeah. So, iliotibial band. Yeah. Two stones in here. You can do other technique like even jostling, but the question is it effective more than usual? I would say do that. So use the stone, get some heat, work deeper, but if you start having topopment with it, all right, maybe, I mean, it's not wrong, but ask yourself, do I do any good service here to myself? Or maybe I can do it just do it with a free hand. It might be better, yeah, rather than, you know, yeah, you can do that. Okay. Any questions? Do you want to see more techniques, or you want to really invent them?
Will we do separately the feet later on, or?
The feet we'll do later on, and we'll do it quite shortly because you see that it's quite sensitive to, and working with gliding on the smaller surface is quite hard, but
Yeah.
you can do that. Yeah.
Go on, one more technique then, if there is.
Yeah. It's actually a lot has been taken from the rest of it. So you can do it this way. Yeah. That one. So actually, it's nothing new. It's nothing new, and I want to think about this. It's just hot stone massage is not a different technique. The technique that I taught you, the flip and glide and the tilting, these are needs to be technique. But once you have that, then yeah, I mean, it's just regular massage with it. So it's actually similar application. Yeah. Similar application, and I want you to kind of see in the. So more, I would like you to do hotter stones, really. More the gliding and the working with hotter stones. Oil. Get the right amount of oil, so you're gliding, but not too much. But on the other hand, sometimes the oil is not enough for the gliding. Okay? Cool.
Can you use the stone as a compression at the glutes to release the...
We have two stones that are in compression stones. I could show you. So you have the two compression stones. You can do it. Usually it's one small and one big. Yeah, one small to smaller area like suboccipital area. This area, same thing. You know, the tilting. It's cold, huh? It's quite cold, yeah. So.
Very cold.
Sorry?
Very cold.
Just come up
Well,
from the fridge.
it's actually we'll talk
It's
about
just different
hot stones.
therapy.
Yes. But yes, put it in the heat if you want, and then try that. I find that to take these stones, you break the contact and do that. I prefer to find, you see, it's not hugely different. So I try to work, yes, sometimes I really need that for trigger point therapy when you really need to dig in, yeah. The rest, I will just use the tilt. Yeah, but give it a try and see if it works for you. You might need to hit it a little bit, and then bring it back to the.
I think they call it the piriformis syndrome or something.
Yes. Yeah, but you can do that with the same stone, with the larger Effleurage, the smaller Effleurage.
All right, let's get
All right,
going.
great.